Welcome to the Putting the Public into Health podcast by Dr. Richard Pan. As we face one of the greatest public health disasters in a century, this podcast will address questions and issues from you, the public, about the COVID-19 pandemic and its impact on people's health and lives. I'm Dr. Richard Pan. I'm a physician with a background in public health, and I'm proud to represent the people of Sacramento, Elk Grove, West Sacramento, and parts of Sacramento County in the California State Senate. I want to share with you important information and stories to help each other during this difficult time. On this podcast, I'm excited to welcome my good friend Angelique Ashby. Angelique is a mother, a small business owner, and a Sacramento City Council member. She grew up in Sacramento, worked her way through college and law school as a single mother. She married an ER nurse and became a community leader fighting for public safety in Newsoms. Angelique and I both ran for office for the first time in 2010 together, and the political pundits didn't think either of us could win. As the only woman currently serving on the Sacramento City Council, Angelique is an amazing champion for families, and she understands the challenges of balancing family and work. Thank you, Angelique, for joining me on this podcast.
Happy to be here. Thanks for having me, Dr. Pan.
So today's podcast is about childcare. Our kids need to stay at home because the schools are closed, and kids shouldn't be getting together in groups. At the same time, we need our essential workers, including healthcare professionals caring for COVID-19 patients in our hospitals, to be at work. And you came up with a way to help them. So, Angelique, what did you do?
Well, first of all, Dr. Pan, thank you so much for doing this podcast. You are a tremendous resource to the state of California and especially to the city of Sacramento, and I'm very proud that you're our senator. I've had the opportunity to work with you for 10 years, and one thing I've learned about working with you and being married to an ER nurse is that it is really important that we continually strive to support the medical professionals in our community. And if COVID-19 hasn't taught us anything else, I hope it has taught us to appreciate the men and women who go to work at the hospital every day to take care of us. In Sacramento, there was an early need for child care for nurses and doctors working on the front line. There was also a need for child care for police officers and firefighters and people who pick up your trash and recycle, the essential city workers. And so what we did was we opened 8 closed community centers and used them solely for the purposes of child care and solely for the purposes of essential city workers and healthcare professionals in Sacramento. We opened 350 spots. We partnered with Child Action, which is an organization here that helps people who are low income have vouchers to pay for child care. And we partnered with the YMCA. They take on the little ones, the babies. And then the city of Sacramento takes the school-age kiddos that need a place to be while mom and dad are out helping all the rest of us.
Fantastic. And so how many kids are able to be handled through this program? Do you have an estimate?
Yeah, we opened 350 slots in total, and there are 60 ongoing full slots and several rotating. As you know, in both the medical and the public safety profession, the hours that people work are a little bit different. So they don't work Monday through Friday 8 to 5 generally. They work 12-hour shifts, sometimes 2 or 3 days on and 2 or 3 days off. And so the program has 60 full-time slots right now and several more available. So if people needed to sign up, there are still openings at the community centers. And it's going really well. The feedback from the nurses and from the folks using it is just a lot of gratitude.
Wow, that's great. And so as you mentioned, many healthcare workers, they don't work, quote, normal shifts. In fact, I don't think many people are. Are there times available during sort of those odder hours and through this program?
So what we did was we did a 12-hour shift for the child care center. It's open 7 to 7, which, as you know, as a doctor, is a really big deal because normally you don't get those kind of hours. What that does for us is helps us with folks who need child care a little bit in the evening or a little bit in the morning or all day during the day. And that helps us touch all 3 shifts for people who work like in the police department or who work at a hospital who are trying to do those ABC shifts.
Wow, that's great. And as you mentioned, certainly our first responders, they're on the very front lines trying to take care of people when someone calls 911 or needs help and they have to come over. They have to go and take care of people, but also protect themselves as well, right?
They sure do. You know, one of the things, too, about the program that's really interesting is we had a lot of displaced workers in the city of Sacramento, just like every other business and every other entity in our country right now. And one of those displaced workers were our child care providers that do after-school care. You started this segment by reminding us that kids are at home because the schools are closed. Well, when the schools closed, that meant we closed our city-funded after-school programs called 4th-R. Well, that entire group of workers was basically unemployed. But when we opened this child care program, we were able to re-employ those 4th-R workers. So we saved quite a few city jobs as well and put them to work in a really needed area. And I just think it was a win-win.
Yeah, no, that's fantastic. Certainly, we have plenty of people who unfortunately are unemployed, and I know that they're suffering, and we're trying to figure out ways to help them.
Yes.
And at the same time, you have a need too, and sometimes what happens, you have people who could help meet that need, but also at the same time, aren't employed because basically of what we're having to do for COVID. But now we're being able to engage them and meet that need. That's fantastic.
And we're not alone in that. We have received so many calls from around the state and really around the country about how we put that program together. So we got calls from Mayor Garcetti's office out of L.A., and Mayor Tubbs' office from Stockton. We helped West Sac and Folsom. We got a call from Folsom Prison and helped them. And I got a call from Fayette, North Carolina, asking us how we put together that child care program. And each of those areas have replicated the system that we put together. I think one of the reasons why it's a standout is that we got it done quickly. And another reason that it's a standout is the partnerships. You know, I didn't just wake up one morning and all of a sudden realize we needed that. I knew that the doctors and nurses were going to need some help because I'm married to a nurse and because I'm so close to you. And so I made those calls to UC Davis and to Kaiser and to Mercy and to Sutter and asked them, would this be something they need? And at the time that I called, they were already looking for solutions for that need. So the partnership made it possible, and then getting it done quickly made it replicable. So it's been a real privilege to be able to help some other cities with even just this small piece of the equation.
Well, that's wonderful. I mean, so I was going to ask you, is this, you're representing the city of Sacramento, but is this available in other places? And it sounds like it either is or it's coming online. It
is. And the other thing is, a lot of times, you get kind of territorial when you're spending city dollars and you say things like, hey, this program's going to be for city of Sacramento folks. But in this instance, we want to help people who are working in the city of Sacramento. They may well live in Lodi and drive into Sacramento to be a doctor. They could still use this child care program. And like I said, there's still some openings available. So if folks have a low-income need, I would really encourage them to reach out to Child Action. You mentioned in your bio of me that I was a single mom. I was, and I used Child Action. I had a voucher to help me pay for child care. I was really poor. At one point, I was on food stamps and used assistance. But Child Action was a real win for me. That is how I was able to go to UC Davis and McGeorge, because I had some offset to those very expensive child care costs through Child Action. They made available for us 60 vouchers during this program. So if you know of a low-income family, but they're still essential city workers, they need to get out there and help us, no matter what they're doing, they could call Child Action and get one of these vouchers, which is just a real treasure. Child Action is an amazing organization. And then we still have some spots at the YMCA, which I mentioned, the YMCA on W Street in Sacramento. They are taking the infants because the city program is really for school-aged children. So there's still openings in all three programs for people who are out there still struggling or looking for help with their child care needs.
Well, that's a fantastic resource. I do want to acknowledge that on April 4th, Governor Newsom issued an executive order waiving requirements for child care eligibility and other provisions to ensure that essential critical infrastructure workers can obtain necessary child care and keep working to assist in the state's response to COVID-19. So we are trying to do some things in the state. It also directed the Department of Social Services and Education to give guidance about temporary child care capacity. And so there's work going on in the state to try to, again, expand the opportunities for childcare while also, of course, maintaining our distancing. And I think that's something I want to continue to remind people about, because we don't.
I think what you guys did really well was made sure that people knew early on that childcare was going to be an essential part of this too. So childcare workers are essential workers.
Right.
So most childcare centers are still open right now. There's a significant number in Sacramento that are still open. And we've had many people call our program and say, if for some reason my child care center has to close, I'm going to need this program. So that's one of the reasons. I mean, we're a bit of an insurance policy for a lot of folks, too. And I'd just like to say this for a moment to all those child care providers out there in our region and beyond who have chosen to keep their doors open and take care of the kids whose parents are going to work to take care of us. Those folks are heroes to us all right now. And I really appreciate them. We wouldn't be able to do this. We wouldn't be bending the curve. We wouldn't be able to do this if those child care providers didn't stay home and didn't stay open. Many of them are in home. If they didn't stay open and continue to serve those kids, we wouldn't be able to have those children's parents helping us in the way that they do. So it's really a great industry that has performed this time around. Really great.
Yeah, no, it is amazing that we have so many people working so hard to protect our communities and also to help support each other, because we can't do it unless we all pull together. And as you said, we're counting on our health professionals to take care of patients when they come to the hospital. We're counting on our first responders to respond when we have emergencies. And by the way, COVID's not the only emergency out there. It's the big one, but life's still happening, and so we need to be sure those services are still going, and then people need help taking care of their kids while they're doing the work that we need them to do. And also, we're talking about lots of other people. I mean, sometimes think when your water turns on and your lights come on, right, or you're going to the grocery store and there's food there to buy. I mean, this is not all happening without people being out, getting their jobs done, so that we can continue to take care of each other and continue to live while we're trying to also slow down this terrible pandemic.
Yeah, and we're used to doctors and nurses and firefighters and police officers being essential city workers or being essential to our city's function or our state's function. We're all very accustomed to that. But what COVID has taught us is to appreciate also those child care providers, the janitors, the grocers, all the people that keep our city running, the person who picks up your trash in front of your house. He or she is still getting up every morning and going to work, and so we need to help them with their children. And that's where those in-home child cares and those larger child care facilities that have stayed open but are still following the state guidelines on social distancing, small classes, the teachers not moving from room to room, the kids not moving from room to room, following all that good guidance that you all put together for us. That is what's helping California right now.
Yeah, no, appreciate that. And I think it is important to mention, because as we're talking about the child care workers continuing to work, that they're also having to work in a new environment, right? Because we are working very hard to be sure we slow the spread of this disease, and we are doing it successfully. So we still see a rise in cases, and so we need to stay on top of this. We can't just let the disease spread, and so everyone is also having to go to work. The essential workers who are going to work are also having to be sure the way they do their work is in a way that doesn't cause the disease to spread more quickly. And so people are having to make adjustments, and particularly think about child care workers.
Yes, I know. I get asked this question all the time. You're a pediatrician and a dad, and I'm a mom. How do you socially distance 5-year-olds? It's like almost impossible, right?
It is.
But they're doing such a great job. They've come up with games and things. And, of course, you and my husband would tell everyone they've made hand washing fun and central to everything they do all day long. Lots of hand washing, lots of distancing. But this order that you all put together that says we keep the classroom sizes smaller than usual, I think 12 is the maximum, but our programs stick to 10. And then the kids don't move from class to class. So if one child or one household comes down with the ailment, it's confined to just that group of 10 children. And same with the teachers. They don't move from group to group. So if one teacher gets sick, which is inevitable, you're not going to run a program with 350 people in it and no one gets sick for the whole 2 months. That wouldn't happen without COVID in a normal period of time. But when we're dealing with something so serious. So we've taken those precautions to heart, and we're doing the very best we can to follow every one of those guidelines.
No, that's fantastic. So, yeah, it is a new day, but we are responding and really appreciate your leadership and coming up. So, by the way, how did you come up with this idea?
Well, I knew that child care would be important. My husband, he's a nurse, RN, and he works at Sutter, and he's the clinical manager for Sutter's emergency room. He was mentioning to me that some of his nurses were worried about child care. And then a couple of police officers mentioned to me that they were nervous that if their in-home child cares closed down, they wouldn't know what to do with their children. And so the mayor came to me and actually asked me for help with this one. He gave me a call and said he had been hearing the same thing. I said, I have too, so I've been thinking about it. And he asked me if I would take a swing at putting together a solution, and I think that was on a Tuesday. We opened the program on that Friday.
Wow.
Yeah.
And some people say government can't move quickly.
We moved really fast. But, all credit goes to really, when you're an elected official, you know this, you make the connections, you make the calls, you find the funding, always with the funding, you work your way through whatever the rules and regulations will be, you try to cut through as much red tape as possible. But at the end of the day, this program happens in 3 days because the city of Sacramento has an amazing parks department. The folks that run our parks department, the folks that work in our parks department, the folks that manage our parks department, they're all incredible, and they were so excited to have an opportunity to help, and I think that's part of the indomitable spirit of Sacramento, that folks are they want to be a part of that rally, and I'm really proud of them. They've done an amazing job, and people are very happy with the program.
No, thank you, and I agree with you. I think the people of Sacramento have really stepped up. That's why we're seeing the results we're seeing right now. And again, people are looking for every opportunity to figure out how to help each other. And I think this is a really great example because it really took people stepping up, saying that we're going to solve this problem. You talked about the numerous partners that were involved in this effort as well. And I too was hearing from a lot of healthcare professionals, but from other people as well, saying that, well, you need me to go to work, but I have kids and schools are closed, or what am I supposed to do? How am I supposed to go to work? Who's going to watch my kids? And so really appreciate that you were able to step up early and pull people together to give them an answer.
Well, I think Sacramento's doing really well, too. But I think one of the reasons Sacramento's doing well is because of our leadership. I think we have a good governor who's doing a great job, and we have you. And you're doing an amazing job. This podcast is just further proof. But I've heard you on the radio every week, and not always on, some type of medical show. I've heard you on sports radio and a variety of kinds of platforms and reaching out to kids. I know you're talking to kids in the high schools. When they have that kind of direct access to somebody like you who not only has science and medical knowledge, but policy and legislative knowledge, I think it changes the game for Sacramento. Somebody who can talk to kids like you do because you're a pediatrician and explain to them why a game of pickup basketball right now, while it sounds fun, isn't a great idea. But, it's not forever. In a couple months, we'll be back to it. But I just think having people like you in leadership roles, and I think the mayor's done a really nice job too, is making a big difference for Sacramento.
Well, I appreciate that. I think it's, again, everyone pulling together. And, again, thank you for your leadership. And I know that, we're certainly, everything isn't perfect. We do our best to try to make the right decisions. And sometimes things, as we decide, circumstances change, and we adjust with those changes as well. So
that's true, and a lot of this is out of our control. We can't control the federal government. We can't, we live in a big state in a big country, so we're like a giant battleship trying to move in the water. It doesn't happen, at the speed of light. We're not as nimble as some of the small countries that are islands, but I think we're showing tremendous dexterity given all of our disadvantages and really trying to use the things that are our advantages, like funding and resources and science and all of that to our benefit and to help others. So I'm really proud of that.
All right. Well, thank you so very much, Angelique, and really appreciate you talking about childcare, and it's wonderful to have you. So again, I want to thank you for listening to this episode of Putting the Public into Health by Dr. Richard Pan. If you have questions or ideas for future podcasts, please email them to senator.pan@senate.ca.gov. Please stay at home as much as possible. Stay at least 6 feet away from others outside. Wash your hands frequently and try not to touch your face. Together, we are slowing the spread of this disease and saving lives. Thank you so much for listening.